Autistic people overwhelmingly need better access to mental health care because we often represent about 8 in 10 of mental health patients accessing services. Here are 5 reasons why we struggle to get access to those services. Number 1, waiting lists that last years. We often have to sit on waiting lists for not just our diagnosis as autistic or ADHD, but for access to mental health services. And those waiting lists are inordinately long, particularly in the UK, and often heavily gatekept or incredibly expensive. And by the time we actually get to seeing someone, the nature of our mental health concerns has often evolved greatly due to the time we've spent waiting on that list. Number 2, therapists are often not trained to work with neurodivergent people because the wider mental health system has failed to acknowledge that engaging autistic clients with mental health services requires nuance and adaptation that simply doesn't exist in much of the mainstream training for therapists. So often we're accessing a talking therapy and either getting no benefit from it or spending most of our time educating the therapist. Number 3, we have clinics that feel overwhelming. A lot of these psychotherapeutic services and psychiatric services take place in environments that are incredibly overstimulating for us, from the basic sensory experience of the lights and the chairs and the sounds and the smells, through to the volatility of other patients who may also be struggling with their own mental health in quite profound ways. Number 4, we have diagnostic overshadowing. This is where things are blamed on being autistic. You're depressed? Oh, autistic people often struggle with motivation and low mood. You're anxious? That's just part of being autistic. It is prevalent everywhere, and it's incorrect because being autistic does not mean we have to live a life of struggle. And number 5, the services simply weren't built for us. When services were designed, they were based on general populations, but if you imagine that as an average line going through a scatter graph, we are quite a way off of that average line. So in trying to create a universal design, what they have effectively done is box out those people who are already pushed to the margins. At NeuroHub Community, we try to create mentoring and group spaces where people can connect and form their own well-being, be empowered to find their own solutions, and experience services and support that is designed for them, that works for them. So if you'd like to find out more about that, you can check us out at neurohubcommunity.org. Otherwise, this Mental Health Awareness Month, make sure you spread the word. Autistic people deserve equitable access to mental health support.